Hi everyone, thank you for coming to tonight's webinar. I think we're going to get started now. So we're the International Student One Health Alliance, and this is the outline for the webinar tonight. So we're going to have an introduction from Bailey, who's part of the ISOHA Executive Committee, and then we're going to have introductions from all of you guys from the One Health committees across Europe. And we're going to talk about student life and how we're running our student groups during the pandemic, partnerships, opportunities across Europe for One Health groups, income, the future of ESOA, and then closing remarks. So we're your host tonight. I'm Elizabeth Taylor, the Europe Continent representative. I'm in my final year studying veterinary medicine at the University of Bristol. And also online tonight is Bailey, part of the Education Committee and event manager for ESOA, and also Andreas is here, who's also part of the Education Committee. So, Bailey, do you want to introduce the ESOA Committee?
Yes, absolutely. So I think the next slide is just some pictures of ESOHA activities, but ESOHA exists to connect different student groups working together in One Health. So these are just some pictures of activities over the years. And we are currently have established a kind of ExCo rotation. So some of the ExCo members are switching to different positions to better fit ExCo members' strengths. So these are our outgoing officers here. And then there's one more slide of outgoing officers. Yes, and then we have the incoming officers. So I will be the incoming Vice President of Education, and Andreas Papas, who is the incoming president, is also here. And Andreas, if you want to introduce yourself now.
Yes, hello everybody, welcome to this meeting. I'm Andreas Papas, the previous Vice President of Education of ISOHA and the current President of ISOHA, and I'm very happy to meet you all today. So one more reason that I'm happy today is that I am actually from Greece, so this is also not just to organize this webinar for me, but to participate really. So I will just tell you that the purpose of this meeting is to meet each other. So don't hesitate to talk and to raise your hands all the time. And I will give you also a personal point of view as I see Europe. I have traveled a lot around Europe, and I see the culture that we have here. And I have a feeling that Europe have a very nice is a very nice place to expand the One Health idea. Everything helps on that. So let's try to educate ourselves and make ourselves better scientists and come out when we finish and start expanding the One Health idea. Okay, we will talk later during the meeting. Thank you very much. Dauda is also here. Maybe he would like to talk. I mean, he's in the next slide.
Dauda, if you want to introduce yourself, you should be able to unmute now.
Okay, thank you, Billy. Hello, everyone. My name is Dauda Ayomide Onawala from Nigeria. Last year, I served as the project manager for ISOHA Education Committee, and this year, I'm going to be one of the VP marketings for ISOHA. I'm very excited to be here, and I hope to learn a lot from how One Health student clubs are run in Europe, and yeah, obviously take some things to help establish One Health student clubs in my region as well. Thank you very much.
Great, thank you. And let's move to the next slide. Okay, yes, ISOHA continent representatives. So in Europe, you have Elspeth and Ergi, and they can be reached at isohaeu@gmail.com. So they can help facilitate communication between the groups that are present today. Next slide. We have a map of One Health student groups from around the world. So you can visit this link if you would like to view the map. And we also have a spreadsheet that I believe we have a link to at the end of the PowerPoint, but we'll be sure to send out a link to afterwards. It's a link to a spreadsheet of all the One Health student groups in the world. So we just want to make sure that everyone's info is updated on there. And if your group is not on the spreadsheet, please get it on there, because that is the document that we build this map from. Next slide. And we also have a map of One Health educational opportunities scattered around the world. So feel free to visit the map. There's different degree programs, certificate programs, internships, all sorts of things like that. Next slide. Okay, so now we'll move on to student group introductions, and I believe Andreas was going to facilitate this part.
Oh, yes. In this part, I would like every representative of One Health Club to, it's better if you raise your hand, you will help me a lot to find who is here, because I have to check all these names here. And I will follow the list that you have signed, and I will ask you to talk. You can say anything you want about your One Health Club. I will give you just some ideas, like what kind of disciplines participate in is your students coming from, or which is your activities briefly. And yes, but don't expand a lot. We are going to discuss further on all these topics later. So I see we have here Elizabeth Brooks. I will unmute you. I unmuted the wrong person, sorry. Now is the correct.
Hi. Hello. So I am the co-president of RBC's One Health group. Actually, One Health / Global Health. We're part of the Students for Global Health large organization. We are not quite a new society on campus, but we have been dormant for a few years. So basically, this past year was our first year kind of bringing it back up, and we're just kind of figuring out what the best approach is to, I guess, spread One Health and One Health awareness like in our school. So we're obviously a solely veterinary school. I think our e-board right now are all just vet students, but we, in our last year's e-board, we did have some veterinary science students, and we are looking to get more into veterinary nursing and wildlife master students. So yeah, basically I think what we're looking at in this year to do is work with teachers and our professors and see where we can provide content to I guess supplement what they're teaching in a more One Health focus, so students kind of have a better idea of what One Health is and how it applies directly to their studies and their life. Hello.
Thank you very much. So I see this is Rebecca. You're still muted. You can just press on the microphone.
So yeah, I'm with the same organization that Elizabeth is with.
I'm sorry, I didn't check that. I just saw the name. So let's see who else is here. Licky Rongers from Hygia.
Yeah, hello. My name is Lieke Ronge and I'm from Hygia. We're a study association from the Netherlands. So yeah, we're now 15 years that we're trying to get One Health into like education and get people enthusiastic about it. So yeah, but there's still a lot to improve. So we're also mainly in veterinary medicine, and we're now trying to expand also to medicine and biology and other people that could be into One Health. So yeah, I don't know if there is anything else you guys want to know, but
Thank you very much. I don't know if you, Vicky, want to add something.
I think
Vicky from
Vicky
your
told me that
organization is
her
here.
microphone doesn't work, so I don't think she'll say anything.
Okay, okay. Thank you. Okay, I see some more people here around, but I don't see your names in the spreadsheet. I will ask Olga if you want to say something. No, she wants me to say something. Okay, I will talk on behalf of Olga since we are from the same club. So our club is mainly, I'm sorry for this one. Our club is mainly for vet students, and but we hope to expand and come closer to other student organizations too. We have participated in several medical students conferences with the representatives to talk there from us. And as we have one part just for One Health, we have one position in our board, the person who is working on One Health. We have started working on to present several seminars on One Health topics. The past years, we have gone to schools to give some presentations to young children. I mean, 2 years ago, we went to several schools in our town, so it was more than 1,000 children educated there. And we had also some other activities like blood donations, etc. So this is from, I didn't say the name. Okay, we are from IVSA Thessaly here in Greece. I will check one more time if somebody from the spreadsheet is here, and then I will ask you the rest to introduce yourselves. Okay, Ada, I will unmute you. You can talk. Your microphone is unmuted. Maybe you can say something. It seems that you have a connection problem. So I'm going to the next, to Alessandra Giacomini. You are muted. Hello?
Yes. Hi. Do you listen to me?
Yes, yes.
Yes. Okay. So yeah, I'm just here as a veterinary student. I'm not in like any organization, and yes, I'm just here to listen. Yeah, I'm from the University of Bologna, from Italy.
Thank you very much. I don't know if we have any representative of your new corporation there that you started recently. I know that you have done a lot of work in Italy with cooperation of more than 7 different organizations on one step. So if we have somebody here, a representative, you can raise your hand to talk.
Yeah. Okay.
Annalena Huber. You are self-muted.
Yeah, there you go. Hi, I'm also not part of any organization. I'm just here out of interest. I'm at the Technical University of Munich, and I'm writing my master's thesis with the Lancet One Health Commission. And I'm really like loving it a lot and very interested to hear what kind of student groups there are and what everyone's doing. Yep.
Perfect. Congratulations for your initiative to come here.
Oh, thanks.
I hope you start something soon in Germany. Then we have Charlotte Rendina.
Can you hear
We
me?
can hear you. Yes,
Oh,
yes.
okay. I'm also here out of interest, and I used to be part of IVSA Milan in Italy, but now I've graduated, and I'm part of the University of Edinburgh, where I'm studying a master's in One Health.
Perfect. Thank you very much. Then we have Denise Podiello. Just press again on the microphone. You're self-muted. Okay, I'm going to the next. Elisabetta Ferraro.
Hello, everyone.
Hello.
I used to be part of Jeff. Can you hear me?
Yes, yes.
Okay. I used to be part of the IFH from the University of Bologna, but I'm here out of interest because I'm doing a thesis on One Health. That's it.
Thank you very much. We have so much Italy today here. I see future there. Gabby DePaul.
Oh, hi there. I'm the president of the Bristol University One Health Society. So we run sort of talks throughout the year. We're trying to get more medical students involved, but at the moment we're mostly vet students. But yeah, we've got plans for the year, so fingers crossed.
Thank you very much. So next is Isabel Corp. It seems that you have a connection problem. I hope we can hear you.
Hello, can you hear me?
Yes, yes, it works.
Hello. Oh, hi. I'm Isabel. I'm part of the same organisation as Gabby, at University of Bristol. So yeah, pretty much just what Gabby said. We're just a group of vet students, mostly trying to get some more medics involved, which would be great. So yeah.
Thank you very much. The next is Jordan.
Hello.
Hello.
Hi. So yeah, I'm Jordan Egan. I'm a vet student that's just graduated from Royal Veterinary College London in the COVID cohort, as we like to call ourselves. And yeah, I am on the IVSA ExCo team, the One Health team with IVSA that Andreas is chair of as well.
Thank you very much, Jordan.
Cheers.
And congratulations for your graduation.
Thank you.
The next is Malvina Kowalska. Yes. Alvina? It seems that there is an issue here. So if you have the opportunity later to fix it, you can raise your hand and talk. Michaela Di Roberto. No, we lost her. I'm sorry. And maybe Olga Ablonito, you would like to say something? I said already for IVSA, especially just to introduce yourself in the team.
Hello guys, I am from IBSA Thessaly with Andreas, and the past year I was editor-in-chief of our local magazine, and I tried to have some subjects that had to do with One Health, so that's why I'm very interested in this topic. Thank you.
Thank you very much. Thank you everybody for introducing yourself, and we are moving to the next session about COVID days. And Elspeth, back to you.
Thank you for your introductions. We thought it would be pertinent to discuss and focus on how the coronavirus pandemic has affected student groups across Europe. So we're going to ask if you've had a chance to read the agenda, there's some questions there that we're going to discuss as a group and to see how different student groups are facing the challenges. So if you would like to join the discussion, just put your hand up and then we can unmute you and see what everyone has to say about it. So what are the main challenges your student group is currently facing due to the coronavirus pandemic? So things that we could talk about is cancelled elections, having to cancel events, the challenges of running online activities. So if anyone would like to start in this discussion, just press the raise your hand button and then me and the rest of the group can unmute you and can get chatting. So, thanks, Gabby. Would you like to start the discussion?
We have a raised hand from Gabby. Oh, I'm sorry.
Yeah,
yes.
hi. Sorry. I think with not being able to meet up, we've planned a few like online webinars, and the attendance for them has actually been much better than would be face to face. I think because we've got a much broader audience. But I think one of the problems that we're facing potentially is that like they're not doing any of the freshers fairs or like sort of fairs to advertise to new students. So I can anticipate that not many people will hear about the society from that side of things.
Thank you. Has anyone else experienced it? Olga, you got your hand up, I'll unmute you as well. Thank you.
Hello guys, from IVSA Thessaly again. We have an annual congress that takes place every year, and all veterinary medicine students from all Greece come together and they present their own papers. And it's also a great chance for networking, and this was postponed, and if we don't manage to do it in October, we will have it online. We also have published our magazine online named Anima. We had a quarantine X-Files competition, which was videos of how we spend our life in quarantine. And it was for Wellness Week. And we also try to share as many links as we can about webinars with our members so that they keep updated and take everything to their full potential. And that's about it.
Thank you. So did most people who are involved in running student groups, did you already have an online presence with social media, or is that something you've then had to develop in the past few months in response to the coronavirus outbreak and having to develop that in order to do outreach? Would anyone like to comment on that? Thanks, Gabby. I'll just unmute you.
Oh, sorry, the meeting got a bit weird. It's Gabby from Bristol again. I think we already had quite a good online presence, and I think the ISOHA page was quite useful for sharing events and things on as well. There's quite a few sort of large groups over Facebook to share things on, which have been quite useful.
Yeah. Thank you. Would anyone else like to comment on how they've had to change the running of their One Health groups? Thank you, Vicky. I'll just unmute you.
Hi. So I'm at the same group as Lieke is. We've always had a short online presence, so we have a website and a newsletter and Facebook and Instagram and all the like. But we never had any lectures or big events online, so we really had to figure out how to do that. Luckily, our university is connected to Teams, so everyone at our university has a Teams account. But it was really innovative, and we saw the same thing that the other groups saw as well. So the turnout for the online lectures is way better than the turnout we usually have, which is happy and sad at the same time. But I think what we'll all realize, I think all the One Health associations, is after this entire corona quarantine and pandemic stuff, One Health will be more popular with everyone. So I think all of us will expect some growth, and online lectures will work, so you can also connect with other people from other countries, which is very important since One Health is a global thing. So I think we might keep on doing things online as well, just to make sure that other people can see what we're doing and we can stay in touch with others. So I hope that we keep doing this, but we had to learn a lot, indeed.
Thank you. And some great points there. I think we can definitely start sharing events between all the Europe groups. Has anyone noticed an increase in members in the past few months, or more interest in their group? Have you noticed anything, Vicky?
We haven't yet, but I don't think people. So we do mostly in person. I don't know how you'd say that in English, but people have to become a member usually in person. So that's something we'll have to change to make it more easy for people to do so online. But that's a whole new system we'll still have to innovate.
Yeah, definitely. Thank you. Leica, would you like to unmute you now and you can join in? Thank you. The self-muted Leica, do you want to unmute yourself?
Now I'm unmuted. So like Vicky just said, we haven't seen any increase in the members for our study association, but we also have a One Health Master since a couple of years in the Netherlands, and there we do really see the increase in popularity. So I started last year with this master, and we were only with 5 out of like 25 spots, and this year it's completely filled, and there's like a waiting list, and everyone all of a sudden wants to do this master. So I think that's a good like foresight for the future.
Yeah, that's really great to hear. How long has there been a student group at your university?
Well, we're from UVA in the Netherlands, so we're now 15 years old, exactly.
And do you think One Health has changed much? I know you don't personally know, but have you heard your lecturers talk? If you think that Student One Health has changed over time, obviously we've had increased numbers on the masters.
I'm sorry?
How do you think Student One Health has changed in the past 15 years that the group has been established?
Well, I only started like learning about One Health myself 4 years ago, so I can't say how it was before that. But I think it's more and more people that start to understand what it is, and like that they understand that someone has to think about problems in a One Health point of view. But we're still struggling with at least the veterinarian students that when they enter the university in their first year, they really want to become a veterinarian, and they're like really focused onto that, and then they struggle to like look at the other disciplines that are involved in One Health as well. So yeah, but I think it's also for us in our study, they really focus on certain topics like food safety, and we're trying to broaden that as well. So the more people will become interested when they see how many interesting topics One Health actually has.
Thank you. So for the leaders of the organisations across Europe, how have you been able to manage your organisation during the outbreak, and how has it affected your decision making? If anyone would like to comment, please raise your hand.
I just have a comment real quick. This is Bailey Archie with ISOHA. So the One Health Commission is working on gathering a long list of articles that talk about how a One Health approach could have prevented or mitigated the pandemic, and how a One Health approach is necessary from preventing further pandemics. So I would just encourage everyone to check that out. There's already a ton of articles listed there, and there are more to come. But that could be a good resource to share just with anyone you know, but your club members especially might be interested. So I just wanted to put a plug in for that.
Thank you. So if there are any last comments, Elizabeth, do you want me? I'll unmute you now.
Hi, can you hear me? Sorry.
Yeah, we can now.
Sorry, can I just get the name of that like database again for those articles?
I'll send the link in the chat box. I'll do that real quick.
Okay, perfect. Thank you.
Okay, thank you for everyone who commented on student life during the corona pandemic. So I think one last thing we can talk about is how you can minimize the negative impacts of coronavirus. But I feel like we've probably already covered that with how we think that it's going to raise awareness of One Health and hopefully get more new members. I think that's a very positive note to end this discussion on. So next in the agenda, we've got talking about partnerships.
Yes, so I will try to manage this section. I will first read the exact description of this session, which says, this subsession aims to provide an overview of the different type of partnerships organizations have with universities, focusing on partnerships between the international level of the organization and universities, not on any kind of local partnerships. But I don't like this part. I would like to hear about local partnerships too. We will focus on that, on what different partnerships exist and of perception of the organization's member toward these partnerships. So I will divide this question into three parts, as I would personally like to hear people answering. So to give you some more inspiration to raise your hand. So what you could say, you could talk about partnerships with your group and your university. How much your university help your organization, your group. If you have some sponsors, how much your professors participate on what you're doing. How much you react with community around your place there. The second part could be what are your cooperations between you and other student organizations, locally or internationally. And the third part, what you could provide as a place for a potential partnership with other clubs on one shelf. So I hope this makes clear what we are looking for here for partnerships. So I'm waiting for your hands to be raised. Okay, we have a hand from Olga. I will unmute you. Okay, you can talk.
Thank you. Hello guys from IVSA Thessaly again. In our department, we participate in the Pan-Hellenic Conference of Medicine students, so we try to bond through that, and we also encourage non-vet students of different subjects like ethology or geology or pharmacology write articles about our magazine. Regarding with our relationship with our university, our professors have helped us a lot, not only in local actions, but also international, like the Congress we have been planning this year. And they also help us find some sponsors so that we can carry out all of our actions. And regarding the local community that Andreas said, we participated in the TEDx and tried to educate about One Health, and also worked with the hospital of Kardica and organized blood donations, but also with the mayor, and organized the World Animal Day, where we had a kiosk and we let people know about animals, what a veterinarian does, and how it is important not only for small animals, but also in general to people's health. So I think that's it.
Thank you very much. Let me check the rest. Maybe Vicky or Rebecca, that is signed on the spreadsheet to represent, maybe would like to say something. Yes, we have hand here.
Yeah, so here's Lika again from ISOHA in the Netherlands. We do have a lot of partnerships with other associations within veterinary medicine, but we also have partnerships with study associations from other studies like biology, medicine, pharmacy, well, almost everything you can think of. Also with law, we've worked together, and whatever we were interested in, and we could think of something that was One Health related and where people would want to work together. So we also get a lot of help from the university, but mostly in like giving us contacts and professors that wanna give lectures on One Health topics. Yeah, and then internationally, we do not have that much partnerships right now, so it's only ISOHA that we know. But we're really looking into that, and we would like to do more international things as well in the future. So that's a thing that we can grow from, and we hope that you guys maybe can help.
Thank you very much. I would like to make a comment here. From my experience, I see that when you try to ask your professors to participate and help in your activities, you give them more inspiration to learn about One Health and really help us professors on the One Health idea. So try to ask them write for you, talk to you, and whatever else. So we have a hand from Vicky.
So yeah, I just wanted to add that if there are any groups near the Netherlands that would like to work with us and maybe do some like we can ship some students over and you talk about how you do One Health and you ship some people to us until we talk about how we do One Health and get some international linkages through this beautiful discussion here. At least that's what I hope we can do. And Lika also forgot to mention that she, our president, and me are going to the One Health Congress, most probably in Scotland as well, in Edinburgh. And that's in October, end of October. I hope to see some of you there as well. And we hope to get some partnerships there and see what more we can do for One Health in Holland.
Thanks for this contribution. Very nice point. And I hope to see some cooperations between European clubs. And we are here to help as much as we can. We have created some materials, and I hope to share with you soon, and you will find them useful to start something new. Since we don't have any other hands, we can move to the next session. And Elspeth, again, back to you.
Thank you. So in this session, we thought we would find out more about how you finance your One Health groups. Would anyone like to comment on how their membership and fees work? Do most of you charge your members? I know someone previously mentioned, sorry, I can't remember your name, about having to buy your membership in person. How do other One Health groups manage their membership of their societies? So again, if you'd like to raise your hand to comment. Hi, Gabby.
Our membership is free, so people don't have to pay to join. So the way that we fund our society is by asking for sponsorship for events. So there's like the Inspire scheme, which has been really good. They're based in like the south of the UK. So I think they mostly sponsor local, like science related things, but they've been really good for the past few years.
Thank you. Does anyone else manage to get sponsorship for their One Health groups? And if so, who or which companies do you tend to use? Hi, Olga. If you would like to comment.
Hi again. I don't really know about the income so much, but as an IVSA member, there is a fee that our members pay that is like €3 a year. So it's not substantial. We mainly use sponsors. We don't really handle money, but when we need something, we ask for them as, for example, bags for a conference and secretarial material. So we don't handle money. And we also have some parties, and the income of those goes to our actions. So we organize some seminars, and we also try to have actions to educate the public, so they might be spent there for all the material we might need. But then again, I'm not very knowledgeable about those things.
Thank you for your insight. Does anyone else have any comments about how they generate income for health groups, or does anyone want to comment on if their groups are normally, if their events are normally free? I'm secretary of the Bristol One Health in England, and we tend to make most of our events free and through sponsorship, and we use that money to buy food, to get more people to come, and then that sponsor then gets their logo on the slides of that evening. So Vicky, let's see what you have to say. Thank you.
So our income is mostly based about contributions. So we're not a free group. So you have to pay €8 a year for students to join, and then you get free entrance to our lectures and discounts on certain activities, actually all the activities, and some of our professors and animal control people, a lot of can sponsor us for €50 a year. And we have a few big sponsors that sponsor us from something between €400 and €800 a year. All that money goes into promoting One Health. So we have activities, we have symposia, we have lectures, we have other activities such as we go to the slaughterhouse to see how that goes, and just try to implement One Health into the curriculum, which is not done all too well. Other than that, we don't make any profit, so all the money we get goes into the group itself, and we try to do as many activities as possible. So that's pretty much our income.
I'm just wondering, when you go to the slaughterhouse, is it mainly veterinarian students that you take with you, or do you get students interested from all different degree backgrounds?
Sadly enough, it's just veterinary students actually. I think almost all of our members are still veterinary students. We really try to, as Lieke told you, to implement other faculties in our doings, but we're not yet as successful, especially not on the things that really just focus on animal welfare, which is really a thing that the veterinary students are interested in. Although we do get some comments on Instagram about our slaughterhouse outgoing, some positive, some really not that positive, but it's a way to, we can interact with these people and tell them about what really goes on and why it's important that we show these things, because it's happening whether we like it or not, and the more we know about it, the better, because we can change it then. So we are trying our hardest to implement, to get other people to join us, but it's not working yet, but we're not giving up, so it's fine.
Thank you very much. That's great to hear. So is there anything else people would like to cover in the income of their societies? If not, I'll hand it back over to Andreas so he can discuss the future of ISOHA.
Yes, just before we start, I think Dauda wants to make a comment.
Oh, yeah.
Okay. Hello, once again, I'm Dauda from Nigeria. I just wanted to say if anyone is interested in running a project with any African Student One Health Club, we are always ready to collaborate with you, especially on online projects. You can contact me directly or send a message to isohaafrica@gmail.com. We are always ready to work with you. Thank you so much.
Thank you very much. I find it very much interesting, and if I had the chance, I mean, now I don't have the chance to work locally, but if I had the chance back, for sure I would do something intercontinental. Especially that I have worked with people now around the world, I see that it's very important. Just let me check the conversation on the chat. Okay. Now we're moving to the next. I don't know if you see the slide. Maybe we can move to the next slide. It's about the future of ISOHA. So what ISOHA is providing till now is mainly the educational webinars that we are doing. We are planning to have 2 more the next week. So it's one for comparative medicine, if you haven't seen it yet, and the one more from Lancet One Health Commission that we participate as co-organizers. And we have our mentorship program that several people participating. And we have our educational maps, as you saw before, and our first journal coming soon. So here in this part, what we would like to hear from you is your opinion. I mean, we, the new board, we have our dreams, we have exchanged our ideas each other. We know what we want to give to you, but here we are to see what you want us to do for you. We are here to serve you, not to just make our dreams reality. So one of my personal goals, so I could start with that, would be to have a meeting with each One Health Club separately to see how everything is in your club and how everything is moving. So what is your point of view? What is your opinions on the current projects that we have? What you can see as future of ISOHA? The main problem that ISOHA is facing right now is that we don't have official members. You are all coming here, but we don't have a fee membership. We don't have official members that we can provide them something. So what's your opinion? How we could move with that to make everything more official, as ISOHA is very new? So to make people more happy to participate. So I'm waiting. I'm seeing some hands here. Elizabeth. Yes, okay, I have to unmute you. Oh, you did it.
Hi, yeah, so I really agree that I would kind of like something a little bit more concrete in terms of like membership, just so that we kind of have like a resource to go to if we have questions or if we maybe want to collaborate with like a different group. So maybe doing like a Facebook page or something that's like members only, or having like an email list or something like that, where just that we have like a resource of like who is actually in this group and who we can go to for different things if we want to collaborate again or just have questions or anything like that.
Yes, that's very important. We have already one Facebook page. I will try to share my screen later to show you, or maybe you, Elspeth, could do that. It's called ISOHA One Health Community, and there you can join and find and interact with other One Health clubs and exchange your ideas and your works. We have a hand from Neil. Neil is a previous president, the first president of ISOHA. He's from America, but he can introduce himself better.
Hey guys, like Andrea said, I'm Neil. Technical point, I am the second president of ISOHA, but that's okay. We were just kind of getting started at that point. So anyways, yeah, I'm a trustee at this point in time, which basically means that I'm old and I just kind of hang around and try to help where I can. As far as basically having this kind of collaborative forum or something to offer, specifically membership, that's a really good point, a really good question. This is something we've, in my time in leadership, that's something we've kind of struggled with or just really wrestled with for quite some time as far as who to consider a member. We weren't really considering a fee structure at that point in time, but of course now this is something that we're sort of pondering. For the time being, and since we really got started, having that membership map, that was really intended to be the resource for people who are in formally structured groups, as well as for people who wanted to find formally structured groups and clubs and know how to reach out to them. It contained the membership map, which I can link later on. It contains all the contact information for clubs that wish to put that out there. And of course, that's not a forum itself. It's not actually something that hosts discussion. It's only something that tells you who to contact for discussion. So if for whatever reason there's a significant amount of feedback saying that the forums that we currently have, that being the WhatsApp, the formal official Facebook page, as well as the ISOHA One Health Community Facebook page, if those do not suffice for any given reason, and we get enough feedback saying that that's the case, I'm sure that we can take the conversation in some direction to alleviate that.
Hey, this is Bailey again. So the North America Student One Health groups created a Slack group a while back. That was Neil and the North America continent representatives idea, but I think that that's worked well, just because it's more organized than a traditional messaging app. So that might be something that the groups in Europe could look into starting if they wanted as well.
Thank you both, guys. We have a hand from Gabby.
I think they sound like really good ideas. I think it would be quite useful to have people's social media accounts as well, so that like say you've got a Facebook page for your group, if they were all connected, I think that would be quite a good way of seeing events that other people are running, especially now while everything's online. So like you're more likely to be able to attend other talks and things. Can I also ask, so I think all of the board are all veterinary students. Was there any like push to try and get medical students involved with like the ISOHA like high up executive committee? Sorry.
Can you repeat the question?
So
Sorry.
on the
Okay, Bailey, yeah.
On the new executive council, Samantha, one of the co-vice presidents of marketing, is a medical student. Patrick is about to start his PhD. Andres, can you think off the top of your head is everyone else a vet student on the new ExCo?
On the new, yes. In the previous one, we had more people from public health studies. We have a hand from Neil. Maybe he knows from even back.
So Abel should be, I believe he just finished his MPH. Correct me if I'm wrong about that. Yeah, I believe all the other people are or were veterinary students, and it was actually all DVM, MPH, basically all American veterinary and public health concurrent students with 2 PhD students back when I was on the board. But of course, we're evolving and diversifying geographically and otherwise.
Yeah, that sounds great. Thank you. Sorry, I missed that. I thought they were all vet students. No, that's great.
No, we're not all. I mean, and the educational webinars that we are doing, we usually have one big percentage from other sciences except veterinarians. Because I don't know if you have ever participated, we usually ask people to give their data from what kind of science they're coming from. So yes, but this is one of our goals. And just to mention that all things you're saying today, it's not just to say for an hour and that's all. We are having our notes from today's conversation and we are going to do our best to make them happen. I see one more hand from Olga.
Hello again. These were great ideas. I would also really like to see them take place or join them as a member organization. But I also think it is fundamental to exchange ideas about how to make One Health ideas easily understood to the public, and also have webinars that are accessible to the public and use the same like grammar, easily understood, and share them not only between One Health professionals. And finally, I would really like a congress that was mixed with people from different areas of expertise. Because Andreas tried to have one this year that was with the SCOH, but I think it was only for IVSA students, wasn't it?
Yes, this one that you're referring to was both for medical students and veterinary students. It's going to happen probably later because of coronavirus. Jordan is also here, one of the organizers of this event. What I would like to thank you for your inputs. Just I would like to mention the part that you said to invite in our events because they are existing. Maybe it's not one every week, but we have like 4 or 6 or 5 per year or more. What we can do as leaders or One Health enthusiasts at least, we can share what we receive. I mean, when we see an email coming, we should try to share the message and invite more people that may be interesting to participate. We have another hand from Licky. I'm sorry for my pronunciation. How is your name pronounced?
Sorry?
How do we pronounce your name?
Lieke.
Okay, I'm sorry.
Oh, no, it doesn't matter. I understand you, so that's fine. I wonder, like maybe I missed this, but I wondered, since there's a lot of students in the Netherlands at least that really like to follow courses in other countries, and we're still looking for One Health courses that are given all over Europe or even all over the world, and that it's often very difficult to find those courses. So I wondered if ISOHA could maybe mediate in setting up a list of like One Health related courses that we could follow from the university as international students. So maybe there is already something like this existing and I just haven't found it yet. But I think that would be a really nice way of bringing people together as well, and then that people could benefit more from ISOHA also, because now there are mostly people here that are in boards of study associations, I think. And then also our members could just get into ISOHA more.
Yes, we do have a map of different educational opportunities and degree programs. So I'll put that in the chat box and we'll be sure to send it out in the follow-up email too.
Okay, thank you very much.
Okay, I will give one more minute if somebody wants to raise a hand. We have one. Neil, again.
So we have been very informally working on a compilation of actual individual courses, and that, as long with many other resources that we have, are a bit Americentric, and it would be, really great to get input from everybody, everywhere, about the resources and courses and institutions and programs that are available to students everywhere. Europe is pretty well represented. Asia and Africa, to the best of my knowledge, correct me if I'm wrong, present as kind of voids on the maps and resources that we have. But if there is significant enough interest, certainly myself, if not some of the other people who are involved with that sort of work, could try and formalize and perhaps even publish this list of courses in One Health.
Thank you, Neil. I don't see any. We have one more. No. I don't see any other hand, so we can end. Somebody's talking.
Elspeth here. On a more smaller level, if any One Health groups are organising online talks and webinars, I run the ISOHA Europe Facebook page. So if you want me to share any of your events, then just send them to the Facebook page and I can share them to all the people who like the ISOHA page. And also, if you want to, I don't know how many people have found our Facebook page, but if you want to share that page with your members, and then we can start collaborating on the different events that we have going on across Europe, especially now when we're moving to a lot of the webinars being online. So one thing to mention is that we're now looking for the next lot of ESOHA continent representatives to come across to be elected. So I've done this role for about a year and a half now. So we're looking to run elections for the next 2 continent representatives for Europe, as well as running it across the globe for a new group of continent representatives. So your role would be helping coordinate ESOHA activities in Europe, liaising between ESOHA and student health groups, and supporting One Health groups in your continent. If you're interested in doing this, then we've created the Google form. It's just it's going to be released later this week. So keep an eye out on Facebook and on our mailing lists, so you can see it. And I think it's a really great opportunity. Everyone seems really keen to get involved, so I definitely recommend doing it. And here's a page with all the email addresses. So there's the Europe Facebook page and the ESOHA Facebook page as well. There's our email addresses. Do you want to make the closing remarks, Bailey?
Just maybe.
Sure.
I just want to mention that this is a meeting. It's not an end here. It's just a start to come closer to each other, to meet each other. We will try to come in closer contact with you, and for sure we are doing our best to bring I mean us in Europe, closer to interact more. In your follow-up email, you will get all the information about each other. I mean your data, so you can find each other. And what Elspeth said about elections, now it's your turn to do something and come to us and help. Probably our next leaders are here today with us today, together with us. So we are waiting for your participation more actively on the ExCo board. Bailey, sorry.
Yeah, thanks everyone for joining, and applications for being on the educational committee of ISOHA will also be going out in the near future, so keep an eye out for those. And a big thank you to the One Health Commission for allowing us to use the GoToWebinar platform. This would not be possible without them. So with that, hope everyone has a great day or night, and we hope to see you at our next webinar, which is happening this Saturday. And I put the information about that in the chat box. But yeah, thanks everyone for joining. Bye.
Right, have a nice afternoon.